So let's look at the shoulder anatomy. It's important to know a couple things about the shoulder. There's 3 bones that make it up. There's your clavicle, oh, that's a lot, your scapula, and your humerus. And what's really important to notice about the anatomy of the shoulder is if I take this away, you can see the tiny surface area that big part of the humerus, that big ball of the ball and socket joint, has to sit on that tiny little surface of that scapula. So that's the first thing to notice, is that there's a lot of surface area of the ball and not a lot of surface area of the socket. So there's not a lot of inherent stability of the shoulder. If you compare that to the hip, we'll go down here and we'll look at the hip, right? Your femur has a really big, I'm just going to get rid of it, really big surface area of that hip joint in there where it can sit on and hang out really nicely. Not a lot of inherent structural stability to the shoulder. The other important thing about the bony structure of the shoulder is this gap right here. So if you look in between the humerus and the clavicle and the scapula, there's that space in between there. One of our rotator cuff muscles runs right through that space. And if that space is not maintained, it can cause a pinching feeling. It can cause all kinds of discomfort for people, especially as they go to use their arm in different ways. So that's the anatomy, the bony anatomy of the shoulder.